All right, thank you very much for coming again. We are talking about ENT topic today. We were going to record this earlier today. However, you just got an emergency case and we had to cancel and postpone this recording. That case was somewhat interesting, and I'm sure that a lot of people have episodes similar to that. So I would like to talk about nosebleed today. So tell me about what happened to the patient.
Oh, so patient actually came in with hypertensive urgency, had pressures in the 200s, and he was in the emergency room, transferred to the ICU, and was started on oral antihypertensives and also on I think a cardizem drip to get the blood nosebleed to stop because he's been bleeding for several days.
Mm-hmm.
They managed the blood pressure, but he just kept bleeding. They placed some packing or rhino rockets into the nose to get the bleeding to stop, but he bled through the packing, he bled through the medications that were given. So at the end of the day, what else are you going to do? You're going to have to go to surgery and get everything taken care of so that he can get out of the hospital at some time. So that was today's very long day.
Wow.
Unfortunately.
You know, I have seen many of those patients usually as a nephrologist because their kidney got damaged and they need the dialysis or something like that. And I have a patient like that in outpatient too who actually have a stroke and got paralyzed on the half of the body at age of 30 something because the blood pressure was 220 over 120 or something like that. Yeah, we do see that, frequently, I guess. Unfortunately, people never find out that they had a high blood pressure until too late, right? So what happened?
What happened? So essentially, what I had to do was I had to identify the major feeding vessel artery into the nose. So I had to cauterize or ligate both of them on each side so that the bleeding calms down.
So this was done in OR with the general anesthesia? Okay.
Yeah, so I will say this is a very rare occurrence. Probably 95% of my nosebleed patients, I can just manage it in the office.
Yeah, I never had a patient who actually had to take an out into the OR to have a surgery. I have seen many people with the nosebleed with a hypertensive urgency or emergency, but they usually, have a nose packing and then gets better, right?
Yeah, but he had nose plaquing on both sides and he was still bleeding, so...
So that's a kind of rare case, and then that is the extreme case of the worst case of all, right? But I think everybody have at least had an experience of having nosebleed and never actually had to go to the hospital or to see the doctor. So can you tell me what regular people can do if they have a nosebleed, or why do they bleed, first of all?
So number one reason why people bleed is because they pick their nose.
Yeah, that's the internal medicine exam question too. Yeah, what is the most likely etiology of nosebleed?
This is both children and adults.
Yeah.
Children won't tell you, but adults, if you ask them about it, at least they'll admit it. But it's because they pick their nose. That's the main thing. And a lot of people come in and say it's because I have so much stress, I have so many things going on, but then when those things occur, probably you have some blood pressure changes and you're hormonally imbalanced. So I'm sure that can trigger a nosebleed, but primarily it's because you pick your nose, or sometimes in children, it's because they stick things up in their nose and parents don't know about it until it starts bleeding and starts getting nasty. So I will say the biggest misnomer with nosebleeds, okay? You have to pinch your nose, right? But where are you going to pinch your nose? Everyone pinches their nose up here. Up here. Don't pinch up here.
Yeah.
Pinch down here. Okay? This is bone. There's nothing to pinch there. So I tell all my patients, pinch up here. If you're not on aspirin or any other blood thinner, 15 minutes. Don't stop. Step number 2, don't raise your chin up. You got to put your chin down. Everyone puts their chin up and they start swallowing all the blood, and then they get nauseated from all the blood in their stomach and they throw up, and then they panic, and then they let go of their nose, and then it bleeds again.
Yeah, it's very common for the teacher to do this, right?
Yes. This doesn't help anyone. So that's the most practical things you can do, right? There are some nasal decongestants that you can buy over the counter. You can soak a cotton ball in the decongestant and stick it up your nose and then hold. That always helps too. If you want to think about prophylaxis or ways to avoid nosebleeds. Saline sprays are always helpful. You can apply ointment or Vaseline to the nose. Patients are always surprised when I tell them just use Vaseline. They're like, you can put Vaseline in your nose? I had no idea. So I tell all my patients Vaseline on their fingertip and just on the inside right here, especially before they go to sleep. If they're able to do that, they can maintain moisture in their nose and avoid coming to see me or avoid having to go to the emergency room. So I don't know all the controversy with humidifiers.
구독해주시고 좋아요 눌러주시면 감사하겠습니다.
Like whenever I mention humidifier, some people love it, some people hate it.
Yeah, I actually was going to have that one episode explaining about humidifier because what happened in Korea was they were putting OxyClean or something, which is basically Clorox, into the humidifier, not washing but just putting in and then humidifying the air, which was the worst, right? You could actually it become an allergen and then it caused a lung problem. So they actually, I think somebody died or something, and then it became a big problem.
There are some things to kind of remember about nosebleeds, though. If you're a teenage boy and you get unilateral nosebleeds persistently, you have to be seen because young teenage men, they tend to have a growth in the back of their nose, which can cause that. So, that's the biggest precaution for young men, but for older adults, it does happen. And if it does happen more frequently, there's always that chance that something's growing in your nose. But most of the time, like 9 out of 10 times, it's just a small blood vessel in your nose or you pick your nose too hard.
So if they have a minor bleed and let's say they have a couple days of a bleed, they can see you in your office, right? Or no? You don't want to see that? We are going to cut it out.
No. I actually don't mind nosebleed patients, but then I'm very careful in terms of what I offer, right? Because everyone comes into my office and they're like, I want laser for my nose. Apparently, if you get laser for the nosebleed goes away. So the next big misnomer is there's no laser for the nose. We do not use lasers for anything in the nose. Okay. So we use in the operating room, there can be electrofrequency coblation, there can be electrocautery, but there is no laser.
So you don't do the electric cautery in the office, or do you?
No. So usually in the office, it's silver nitrate.
Okay.
So just silver nitrate sticks, but more so than that, it's a matter of identifying. You have to do a nasal endoscopy to identify where the bleed is. And then once you identify it, you cauterize it. But I like to cauterize patients that are actively bleeding in front of me. If they haven't bled in the last week and they come to me wanting something cauterized, I tell them the cautery is going to make you bleed. So if you're willing to take that risk and understand that, then sure, I can help. I can cauterize it, but that's the risk that you take when it's not a very frequent thing.
Yeah. Another thing that I find many people do is they pinch their nose correctly and do that, but within 2 minutes they just check and then blow their nose and then see what comes out, and then they keep bleeding, and then they put the water in it, melt all the clot, and then keep bleeding.
So 15 minutes if you're healthy. I say 20-25 minutes if you're on aspirin or anticoagulant. Do people really do it for 15 minutes? I don't know.
Yeah.
I know I don't.
yeah. I haven't seen anybody who do that long. I tell them like, okay, do 15 minutes, and then they're like 3 minutes they are checking already.
Well, that's why you tell them 15, right?
Yeah. Probably more than 90% of the time when people bleed, then it goes away without seeing any physician. So correctly pinch your nose, do not put your head back, and then see what happens. And if it continues to bleed, go and see ENT doctor.
Yeah, I mean, there's a lot we can do in office, in the operating room. Sometimes there are just baseline anatomic issues that needs to be fixed to help with the nosebleed.
Okay. So next time we will continue to answer some questions from the viewer, and but also I'd like to talk about nasal spray in one of those next episodes. Okay. Thank you very much.
All right.
Bye.
Bye-bye.